At least half the world's population is now living under some form of lockdown, as countries everywhere attempt to curb the spread of COVID-19. Hospitals are preparing for or already dealing with a huge influx of patients and are mobilizing doctors from every department to help treat COVID-19 patients requiring urgent care. We spoke to doctors on the front lines across the globe to hear what they're experiencing and what they want you to understand about the pandemic.
Our health system, it's a great system. It's free for everyone. But in the past years, there was a lot of a shortage of money. Doctors in Italy are, I think, the less paid in Europe. We are in emergency and we work 20 hours in a day if it is necessary. But it's hard when you see that actually the situation when we are is because of the bad choices our government performed in the past years. All the infection control measures are really the most important things, because intubated and ventilated, we are too late. We have to arrive before that. So yes, I'm afraid about my colleagues. The last week, a nurse from another ward get intubated in our ward, and it was hard because, it could be you or the people usually you drink a coffee with in the normal life. We are afraid, but we talk a lot about it.
The healthcare system in the UK, maybe because it's free and so accessible, is a bit, it was stressed already, and it was working at the maximum capacity already before the crisis. And this crisis puts an extra strain on this system. What shocked me is the amount of young people that are really sick, people of 30 years old, that are in need of mechanical ventilation. I've never seen things like that in this amount. Until now, we've been able to decide that everybody that needs advanced care and a possible intubation or an ITU treatment can have that. But now the influx gets larger and larger, that sometimes we have to make or start making decisions about this elderly patient. Does he need maximum care?
The emotional toll that this has taken on myself and I think many of my colleagues is something that we never necessarily thought that we would deal with. No one is comfortable with the idea that you're going to have to be potentially faced with choosing who lives or dies. No one goes to work in a regular hospital because they want to be participating in wartime triage. To have that every day at work and then come home and do my best to social distance and stay inside, it's been super stressful. It's very frustrating for me to come home from work emotionally overwhelmed and see a group of 10 people going into an apartment in my building like they were going to be having a party. And even more frustrating to me is that many of them are wearing either cloth masks or N95 masks that we are so short on all over the country, giggling and laughing and just not really getting it. And so much of medicine, what we do is just a better safe than sorry approach to things. And I think that, the country as a whole, I wish that we had done that sooner rather than later.
Our patients in the hospital, they cannot get visits anymore, or they can only get visits when they're really dying. We now learn a lot of patients how to use FaceTime, how to use WhatsApp and Skype, so they can meet with their family by screen. Sometimes we make a round at the ward and we talk with the family, we show the patient how he's doing, things like that. But for the family at home, that is the hardest part. And now we have a larger team of psychologists in the ICU and also for the pneumology department, so that the nurses and the doctors also can talk with somebody during the day just to ventilate how they feel and how hard things can be during the day when you work with these patients. It's very difficult to imagine when you're at home in your sofa watching your favorite series again and again, how ill people can get, and that it's lethal, maybe you should compare it to World War II. And I think it's maybe worse, or it can get worse than World War II. If we discuss with colleagues, the oldest, they say, yeah, our parents, they had World War II and we will have had Corona.
Fortunately, we have sufficient PPE, so every time when we see the patients, we can change our clothes. Our center offers a lot of measures like protection booths, which is a transparent box to minimize the contact. And we also perform sterilizations of facilities several times a day. 1 month ago, it wasn't like this. After a mass infection of health workers in Daegu in February, attributable to inadequate supply for protecting them, some kind of paradigm was changed, and now there is multi-level barriers for doctors and nurses. The advantage that Korea had was transparency. So Korean government has focused on building up the trustness between people and authority via sharing information very, very transparently and very, very rapidly. We can go back to our normal life for more time if we end earlier. And for that, we have to perform more strict measure and try to follow the recommendation and rules. As Albert Camus says, the only way to fight the plague is with integrity, and the degree of integrity will define when this outbreak ends.